Okay, good afternoon. At this time, we'll have a call to order. Welcome everyone to the MCAB meeting February 9th, 2023. At this time, we'll have a flag salute led by Sheriff Donnie Youngblood.
Salute, pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. At this time, we'll take roll call. Mr. Ferris.
Thank you, Mr. Chairman. Dr. Lyon. Here. John Surface. Here. Leslie Wilmer. Here. Chris Miller. Here. Sheriff Youngblood. Here. Dr. Kansen. Orchel Cryer. Here. Tyler Weitzel. Here. Chief Wells. Here. And Chairman Flores.
Here.
We do have a quorum.
Okay, at this time, we'll go into the consent agenda. All items listed with the CA are considered by division staff to be routine and non-controversial. Consent items may be considered first and approved in one motion if no member of the board or audience wishes to comment on or discuss an item. If comment or discussion is desired, the item will be removed from consent and heard in its listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. At this time, is there any members of the public who would like to talk about a consent item? We've seen none. Any members of the board before we entertain a motion? Okay, seeing none. Okay, we have a motion. Second. Motion second. Cast your vote.
I'll just go ahead and poll. Okay. John Surface.
Aye.
And Chris Miller. Aye. Sheriff Youngblood.
Yes.
Dr. Kansen.
Yes.
Orchel Cryer.
Yes.
Tyler Weitzel.
Yes.
Chief Wells.
Yes.
And Chairman Flores.
Yes.
Okay, motion passes. All ayes.
Thank you. Okay, item 6, subcommittee reports, APOT task force. Mr. Ferris.
Thank you, Mr. Chairman. The APOT task force, consisting of representatives from all hospitals, ambulance providers, fire agencies, and our department, was created in 2019 at the request of then Chairman Maggard. MCAB charged this task force to meet monthly in person to identify challenges in the hospital setting that are leading to the long offload times and to develop solutions to overcome those challenges. Like with most other industries, the hospitals are struggling with staffing shortages. Nurses have specific nurse-to-patient ratios, and the hospitals will not offload patients unless they can meet those ratios. Due to staffing challenges, at times the hospitals are not able to open all of their hospital beds. Additionally, system-wide, we are experiencing a significant increase in psychiatric holds, at times taking up to 7 days to find alternative placement for these patients. This delays discharge of these patients and causes a backlog in the admission of new patients. As reported to the Board of Supervisors on Tuesday, our ambulance providers were held waiting to offload 17,240 hours in 2022. At this point, it appears that there is little that can be done to resolve this issue other than overcoming staffing issues and an increase in infrastructure to accommodate psychiatric patient movement out of the hospitals and into more appropriate settings. Furthermore, attendance at our monthly meetings is spotty at best, and many of the attending agencies have requested to meet less frequently. For these reasons, I am requesting that the board approve moving the APOT task force to a quarterly meeting that is 100% virtual, which seems to increase attendance. That concludes my report on APOT.
Voting item, correct?
Technically, I think it is to move
Okay.
APOT to a
Okay.
quarterly meeting and have it virtual.
Motion second.
Okay, I'm sorry, with the masks on, I apologize. I need to know who motions and who seconds.
Youngblood motion.
Youngblood motion. Chief Wells seconds. Okay. Okay, Dr. Lyon? John Surface?
No.
I'm sorry?
No.
Leslie Wilmer?
Yes.
I'm sorry?
Yes.
Thank you. Chris Miller?
Yes.
Sheriff Youngblood, you motioned. I assume you're a yes. Dr. Canson?
Yes.
Orchel Cryer?
Yes.
Tyler Weitzel?
Yes.
Chief Wells, you seconded. And Chairman Flores.
Yes.
Motion passes. 1, 2, 3, 4, 5, 6, 7, 8, 9 yeses and 1 no.
Thank you, Mr. Ferris. Okay, that brings us to item 7, public comments. This portion of the meeting is reserved for persons desiring to address the board on any matter not on this agenda and over which the board has jurisdiction. Members of the public will also have the opportunity to comment as agenda items are discussed. Is there anyone wishing to make public comment at this time? Okay, seeing none, we will proceed to item 8, which there's no public request. Then brings us to item 9, unfinished business, EMD study implementation. Item 8, Mr. Ferris, if you want to lead with the staff report.
Thank you, Mr. Chairman. At our last meeting, I presented a study that identified our emergency dispatch system as over-triaging 911 medical calls approximately 50% of the time. The tool used to complete the study was obtained from another EMS agency in the state that had utilized it for the purpose of correcting their over-triage. It has been proven effective and is currently in use in 4 counties in the state with no reported negative outcomes. The study encompassed 2 years' worth of ambulance data as entered by our pre-hospital care providers. The study showed that during the years 2020 and 2021, our Kern County ambulances responded with lights and sirens 160,265 times, or 71.20% of all 911 medical calls. However, only 4,179 patients, or 2.61%, of those calls resulted in lights and sirens transports to the hospital. Additionally, studies have shown that operating with lights and sirens increases the risk of accident, injury, and death by 200% when responding to an emergency call and 400% when transporting with lights and sirens. Furthermore, during the study time frame, the average response time difference between lights and sirens and no lights and sirens was 1.2 minutes. During the November MCAB meeting, Chief Wells made several requests for information to be considered in addition to the EMD code study. The first was accident data during the study years. We requested accident data from all of our ambulance and fire providers in Kern County and were able to receive data from Hall Ambulance Service, Liberty Ambulance Service, California City Fire, and Kern County Fire. Kern County Fire reported the highest number of accidents in 2020 and 2021 with 11 accidents. 9, or 82% of those accidents, occurred while the vehicle was operating with lights and sirens. Hall Ambulance Service reported 5 emergency vehicle accidents, with all 5, or 100%, occurring while operating with lights and sirens. Liberty Ambulance Service reported 3 accidents, with no accidents occurring while operating with lights and sirens, and California City Fire reported no accidents occurring during that time frame. The accident data in Kern County indicates that 14 of the 19 reported accidents, or 74% of accidents that occurred during the 2-year period under review, included operating with lights and sirens, and supports the risk of operating with lights and sirens is real and results in traffic accidents in Kern County. The second request was to look at fire agency data. While we did review fire agency data, fire agencies do not respond to all 911 medical calls in Kern County. Specifically, in 2022, Kern County Fire submitted 49,089 electronic patient care records, which represents 38% of the total 911 medical calls for the year. Of those, 12,531, or 25.53%, were submitted as canceled with no patient contact. Of the 36,558 responses that resulted in patient contact, Kern County Fire reported initiating patient treatment on 4,638 occasions, or 12.7% of their patient contacts, or 9% of their total responses. Because fire agency data does not provide a complete picture of the incident, as it does not provide the transport side of the call, and the fact that they don't have data for all the calls included in the study, adding it would duplicate information for some calls and dilute the data, making it inaccurate. Additionally, Kern County Fire Agency data is currently out of compliance with EMS EPCR policies, making it unreliable and not appropriate to be used for the study. The third request was for a quality improvement method for ongoing monitoring on the calls that occur in the EMD codes that we're changing. First Watch, the system currently used by Kern EMS, has created a trigger to monitor all downgraded EMD codes. Any downgraded EMD code that is transported lights and sirens will be flagged and investigated immediately by EMS staff. Additionally, if 10% of the call volume in any downgraded EMD code call is transported using lights and sirens, in a 30-day period, the code information will be flagged and reported to the steering committee. The steering committee will review the call information and make a recommendation to the EMS medical director regarding the EMD code. And finally, EMS will be completing the study and updating the system responses every 2 years to assure that our responses are appropriate on an ongoing basis. It was important for us as an agency to approach a large change to the EMS system in a transparent manner, including feedback from all relevant stakeholders. On September 22nd, 2022, we held an initial meeting with stakeholders introducing the study and our proposed changes to the EMD code. All stakeholders were provided 30 days to submit comments. Kern County Fire and Bakersfield City Fire requested a meeting to further discuss the study and the proposal. However, there was no comments or feedback received within the 30-day comment period from any stakeholder agency. Kern County Fire subsequently requested a second 30-day comment period, which was granted. No comments or feedback was provided during the second 30-day comment period. Kern County Fire requested additional time to provide their comments, which was provided to them. When their comments were received, it was simply a spreadsheet indicating which changes they supported and did not support, without concrete explanations for the 169 codes they did not support. The comment document, however, did show where individual components of the study were used to not support a specific downgrade, and if a firefighter initiated any care, the code was also summarily denied. In a separate meeting, Kern County Fire indicated they had a concern with any downgrades to the 10 card, which is a category of EMD codes related to chest pain. The study data shows that the 10 card represented a total of 16,320 patients, with only 1.8% or 288 transports warranting the use of lights and sirens. At another meeting with Kern County Fire, they indicated concerns with any EMD code downgrades that suggested BLS ambulance as the only responder. The study reviewed 37,300 patients that were originally dispatched, in EMD codes that are recommended to be downgraded to BLS ambulance-only response. Within the 37,300 patients reviewed in these codes, there are 70 that were in cardiac arrest. These 70 patients matter and were considered in this review. However, we must look at the entire system and consider all factors. First, there are inherent inaccuracies in coding a call that occurs when people call 911 and try to describe what is going on when in a stressful and chaotic situation with a sick loved one. Furthermore, these 70 patients were either not in cardiac arrest when the initial 911 call was made, or the cardiac arrest was missed by the dispatcher, as these calls were not coded as cardiac arrest calls. Maintaining a system focused on these 70 outlier patients while ignoring the other 37,230 patients receiving a higher level of care than necessary is not the appropriate approach. The appropriate approach is to build a system that accounts for all patients, and that is what this proposal does. And finally, Kern County Fire indicated that they cannot support our changes because of ambulance response times. Our understanding of their concern was the effect downgraded calls will have on their crews waiting on scene for the ambulance to arrive. There are 51 downgraded codes included in the study that continue to recommend fire agency response, which totaled 1,751 calls in 2022. On Tuesday of this week, we presented a report to the Kern County Board of Supervisors on ambulance response time compliance. While we know there have been some delays in response times, we have been collectively working to evolve the EMS system, and these system enhancements have resulted in an improvement in ambulance response times. Additionally, the study has suggested that fire no longer needs to respond to 68 EMD codes, which accounted for 6,641 calls in 2022. This will help alleviate their waiting on scene for the ambulance for these calls. We strongly believe the implementation of these EMD code response changes, along with the fly car policy, will result in shortened wait times on scene as the proper resources will be available to respond. In our continued effort to collaborate and in response to the concerns raised by Kern County Fire, we made several concessions. Specifically, we agreed to have a minimum data set of 30 patients per EMD code to be considered within the study. This change decreased the total number of EMD codes considered per change from 454 to 243. The number of suggested EMD code downgrades also decreased from 196 to 119. And recommended EMD code upgrades decreased from 34 to 23. Fire also requested the ability to retain their EMD override codes and to not consider echo level downgrades in the study. There was only one echo level downgrade considered in the study, which happened to also be an override code. Because override codes are an optional code to use by dispatchers and not a code generated by the system, we agreed to remove the override code from consideration in the study. Additionally, we reduced the response time for the new committed Priority 3 response code from our initial proposal of 20 minutes to 15 minutes. Although we continued to meet with Kern County Fire in good faith in an attempt to come to a consensus on this issue, unfortunately, we bring this final proposal to your board without complete agreement on the EMD code changes proposed. The EMD code study has been vetted and proven to be accurate and effective in lowering the risk associated with licensed sirens operation, and is a tool that can help in advancing our local EMS system by assigning the most appropriate response based on our local patient data and salvaging the more advanced resources for the calls that actually need them. We are creating a system that will assure the proper resources are available to respond to these patients when they need it the most. The EMD study changes, coupled with the fly car system, will ensure that paramedics are available to respond and provide proper levels of care when needed. Lastly, included in your agenda packet, you will find a joint statement on Lights and Sirens vehicle operations on emergency medical services responses that was issued on February 14th, 2022. The joint statement was sponsored by the Academy of International Mobile Healthcare Integration, American Ambulance Association, American College of Emergency Physicians, Center for Patient Safety, International Academies of Emergency Dispatch, International Association of EMS Chiefs, International Association of Fire Chiefs, National Association of EMS Physicians, National Association of Emergency Medical Technicians, National Association of State EMS Officials, National EMS Management Association, National EMS Quality Alliance, and National Volunteer Fire Council. This statement states in pertinent part, the purpose of using lights and sirens is to improve patient outcomes by decreasing the time to care at the scene or to arrival at the hospital for additional care. But only a small percentage of medical emergencies have better outcomes from lights and sirens use. Some agencies have used an evidence-based or quality improvement approach to reduce their use of lights and sirens during responses to medical calls without any discernible harmful effect to patient outcome. Emergency medical dispatch protocols have been proven to safely and effectively categorize requests for medical response by types of call and level of medical acuity and urgency. Emergency response agencies have successfully used these EMD categorizations to prioritize the calls that justify lights and sirens response. For many medical calls, a prompt response by EMS practitioners without lights and sirens provides high-quality patient care without the risk of lights and sirens related crashes. EMS care is part of the much broader spectrum of acute health care, and efficiencies in the emergency department, operative, and hospital phases of care can compensate for any minutes lost with non-lights and sirens response or transport. There is a situation occurring in our county at this time that is very pertinent to our discussion of the use of lights and sirens. In the early morning hours of January 19th, 2023, a Bakersfield police vehicle was involved in a collision at South Vineland and Mueller Road, resulting in the death of an individual and injuries to multiple other victims, including the officers. The attorney for one of the victims is quoted, "It does not appear to me that the officer stopped before entering the intersection. And this is why the Code 3, also known as Lights and Sirens On policy, will be analyzed in this case." The purpose for me bringing this to your attention is that the attorneys for the victims are pressing for the officer to be charged with vehicular manslaughter. If that occurs, it will definitely have an effect on EMS and all lights and sirens use in the future. Now, moving on to the ambulance performance standards. These are linked together, so I'm going to give the report for that if that's okay with the board, and then we will discuss the vote for both of these together. The Ambulance Service Performance Standards, or the ASPS, is one of the tools in which the ambulance providers operating in Kern are measured. Both the ordinance and agreement contain basic performance provisions. However, the standards further define performance requirements for ambulance providers. The standards provide definitions that are in accordance with ordinance definitions, as well as the standard compliance for response times, level of response, and type of response. The ASPS goes hand in hand with the requested changes to the EMD study. In order for the EMD study changes to occur, we must also make those same changes to the ASPS. Along with changes to the response codes, you will find proposed changes to the mandatory basic life support compliance that was in effect for years, and the option for ambulance providers to operate a fly car system. A fly car system would allow paramedics to be placed in first response vehicles while EMTs remain in the ambulances. The fly car system was trialed in November and December of 2022 and proved successful at getting the paramedic available 64% faster in the system. Specifically, on average, during the trial, the paramedic units became available within 25 minutes, while the other units became available within 1 hour and 11 minutes. We believe the proposed changes to the ambulance service performance standards present a significant improvement to our EMS system by creating new dispatch response codes, allowing for increased BLS response, and by providing an alternative to the standard ambulance-only distribution. These proposed changes consider the safety of our crews as well as the public while providing the most appropriate resources to the people of Kern County. Making these changes is the right thing to do for our community and our EMS system and for the safety of our pre-hospital care providers, and is fully supported by many national and international emergency medical service associations, and therefore I respectfully request that your board approve the EMD study changes as amended and the ASPS update with an implementation date of March 1st, 2023 at 0001 hours. That concludes my report.
Are there any members of the board that have any questions or comments?
I'll make a quick comment. Sure. After listening to Mr. Ferris's report, I think it's fair to say that we agree to disagree. The fire department spent a considerable amount of time, hundreds of hours, looking at this, and I think the focus on some of the positive is with meeting with public health and county EMS. Out of the 454 codes that there are in the EMD, we do find concurrence on 378. So at the end of the day, there are 76 codes where there are questions where I think warrant further discussion. Of those 76 codes, looking at the study that was represented by Mr. Ferris from other counties, the CCMSA, they fall in line with the fire department's perspective 43 times out of those 76 times. And so I think the discussion that we look to have is to get collaboration and understanding why there are differences so that we are confident moving forward that we're doing what's right in the best interest of the public, the best interest of all first responders. But I think we've made a tremendous amount of progress from our November meeting to now. And unfortunately, progress takes time. It takes collaboration, and we look forward to continuing that discussion so that we're confident that we are doing the right thing. I appreciate, Mr. Ferris, you diving into the vehicle accident. That was a request that I did make. And it's a concern when we look at these studies and we want to make sure that while it might be an occurrence nationally, is it here locally? And so it allowed us to look at our accidents. As you mentioned, we had the highest amount of vehicle accidents. But one thing I think is worth mentioning, over half of the accidents that we did report were in response to fire incidents, so that they would be excluded from the study. At the end of the day, of the 25 incidents that we reported, 21 were going code 3, 2 of which were involved that had injuries to others, and two injuries to firefighters. So there was, in our perspective, a very minor occurrence. While we know that there is inherent risk with going code 3, that's a risk that we take seriously, and we focus on training our firefighters through a rigorous program that takes up to a month for them to get through driver operator 1A, 1B, and an engineer academy to make sure that they have the tools and the skills necessary to take that accountability when we're asking them to respond code 3. So I wanted to point that out. And just the biggest struggle with the EMD study is it is a big change. And the fire department, while I do wear this uniform, I am representing more than just Kern County Fire. I'm representing Bakersfield Fire and Cal City Fire, and all 3 fire departments in the county, not just the Kern County Fire Department, stand in concurrence with the
the need to find more information to further discuss the changes, specifically the 76 E&B codes, where there are disagreements between county EMS and the fire service. I think we can get there. I think we've proven by finding concurrence on 378 and feeling confident in those that we can, but it's going to take more time. And I look forward to, evolving the system and changing the system for the better, because this is a system not just for us, but it's for the community.
Yeah, I have a couple of questions. The study in comparison with other counties, I run into this all the time. Police services in Kings County is totally different than police services in Kern County, where we may be driving 50 miles to a call, as we're one of the larger counties in the country. Other counties, that would be unheard of. So we respond code 3 sometimes when we're in the desert, when if the same call were to occur in Bakersfield, it probably would not. There's a difference in that. And have we considered there is some protection for the county and for hall ambulance, for that matter, when you're rolling code 3 and you have an accident, as opposed to not rolling code 3 and having an accident, you have no protections. You're following the rules of the road, period. We tend to have younger employees who want to help people, and they tend to push the envelope, and if they're not rolling code 3, they tend to go 10, 15, 20 miles over the speed limit, which puts them and the county in jeopardy. So those factors are important to me to consider.
Sure. Anyone else before we go to the public?
Mr. Chairman. Yeah, I think what the chief has told us is that a lot of work has been done. I think that we got to get this right. We want to protect the public. We want to protect our responders. We also want to, make sure we provide the best patient care we can. And I think before we rush to do anything, let's continue to try to work out these differences so we can all be feel good about what we're doing.
Thank you, Mr. Surface.
I would ask two questions. One about the response times, the configurations, and then about the flight car, right? The flight car discussion can be handled on its own, regardless of the first discussion.
Okay. That's fine. If you want to separate those two out and vote on them separately, that can be done as well.
So thanks for the explanation, Jeff. I think a lot of what Chief Walls really resonated with me. Take this off in case you can't hear me. I think to his point, about some consensus on a majority of them. I mean, is there any reason, possibly at this meeting it's said early, but that you couldn't just separate those out and approve the 378 and continue discussing the others for another time? I mean, is there some reason to rush for everything all at once?
Well, first of all, this process started last year. I don't view this as a rush, and I'm sorry, but I have to make a statement here. I am not aware that we came to consensus on anything, Chief. I'm sorry. I didn't leave any meeting with the impression that we agreed on anything. I apologize for saying this in this format, but I'm unaware of the 378 consensus that you're speaking of. So that's news to me.
So,
Okay.
Just kind of going through my thoughts, a little scattered. Talking about the tool sum and data that goes into that, was that primarily just ambulance data, or did we look at any downstream, mortality rates or any type of patient impact?
Well, at the last meeting, John Surface volunteered to do some hospital data gathering and do some follow-up. Mr. Surface, do you have that information?
We sent some of that to you. We don't have our hospitals are not submitting their data at the rate they should. So Scott is still working on that. That's probably another 2 weeks for him to give you conclude. He sent you some stuff. He sent you the cardiac arrest stuff, but
as you know, they've all been out running ambulance calls for the last 2 years, so it's a little harder for us to pull it together. But we don't have any data from Kern Medical. They're not part of the HDE network, and then some of their hospitals, the doctors are not closing the files the way we need them to for us to get the data.
I do know that in some of the data that you sent me in the hospital, of the hospital data, of the hospitals that did report out, there was a number of several thousand patients that fell into the 10 card category, I believe it was, and that 80% or 88% of those patients were released within 24 hours and sent home.
More than half of those were released within 12 hours. And there was a big chunk of people that were released within an hour or walked out, just eloped and left. So, but some of that you'll find in every, regardless of the EMD code, you're going to find that across the board. But to be able to give you real conclusive evidence, a little bit more work would need to be done. But and I haven't seen. I'd be interested to see what the breakdown is between those that you've agreed on and those that are in disagreement. I understand there's a difference of opinion. The chief has some that he feels you guys have agreed on. I'd love to see what those are. And I know now the bad thing is what I'm saying is take more time. It's not what we want to do, but that's what it sounds like for me. But I do think that I know the problem exists, and I know that people across the nation are making changes to configurations to resolve the problem. And but I do owe you a whole lot more data to be able to be conclusive. But I think the early returns that you've seen supports that we're way over triaging, and that's not an individual error necessarily. It's just the way the system is set up. And I don't want anybody to think that we think they're doing a bad job, because I don't. I think our EMD folks around the nation do a tremendous job taking a very sometimes hectic situation, or a person that may be inebriated, or a third party from 100 miles away is the one calling. There's a lot of stuff that plays into that. I just don't think that anybody is making an individual mistake.
And then just one more follow-up. Sorry. The EMD code changes, do those have an impact on the response time requirements at all for those codes?
On requirements, if
yes.
They're downgraded calls, they go from, if it's a priority 1, it goes from 8 minutes and 59 seconds to 15 minutes now. They will have 15 minutes to respond, no lights, no sirens. Now, keeping in mind that the average difference between code 3, lights and siren response, and no lights and siren response on a daily basis in our system is about 2 minutes. I monitor that daily. So as I monitor that number, and like I reported out, the difference over the 2020 and 2021 was 1 minute, 1.2 minutes was the difference. Right. And factoring in that there are currently no studies that show lights and sirens have any effect on patient outcome at all. Sure. Yes.
I want people to know that the fire chief and I spent a great deal of time in our outlying areas in Bakersfield giving information on Measure K for people to vote for Measure K or not vote for it. And one of the selling points was more staffing and quicker response time to medical aid, to sheriff's calls. And I feel a little bit obligated to not go back on what I said, not knowing that this was coming. And I think the fire chief would probably feel the same way. But we did say that. And it seems to me that the logical thing to do, because we have a disagreement on whether we even have any agreement at all, is to go back for another 90 days before our next meeting and see if the fire chief and you can come to a consensus to alleviate this roadblock one way or the other. If not, we'll just have to go. That would be my suggestion.
I like that suggestion, and also that of Mr. Weitzel's. I think that would be a prudent approach, since we thought we had agreement on this on the 378. We're working on the 76, but evidently we may not even have that. So I'd like to know with certainty, what is our baseline? What do we have in actuality in agreement, and where do we go from there? And I think that it would behoove everyone in the system to have more study, get together, see where we're at, and drill down on those last remaining items. And I appreciate where you're going with this, to take this up, because you want to improve the overall EMS system. And I think it's well intended, but the details are so important that we have to get this right. We've got key stakeholders, not only in the county, but in the city and other jurisdictions I was mentioned. So, we have to get this right. And, safety is paramount, not just for transport, but also safety for the patient. And I think that it would behoove everyone just to get more time to study it and come to agreement and see where the chief's at, see where you're at, see where agreement is, and how we can move forward on the remaining items.
Thank you, Mr. Chairman. Well, I appreciate all the comments that were made, and I understand everybody's perspective. I do. My concern, based on the meetings that I have been involved in with Kern County Fire, as I said, I never left a meeting under the assumption we agreed on anything. And my concern is that we are wasting another 90 days to go back to the same ineffective meetings where there has not been, there has not been a consensus from my perspective. And my concern is we're just wasting another 90 days and pushing this can down the road, and there will not be any consensus in the next 90 days either. That's my concern.
Dr. Lyon.
The importance of this is a safety measure for our personnel. This is to keep our firefighters, our EMTs, our paramedics from being injured, as well as the public. We don't want a fire engine running into a family of 5 like in Phoenix a couple years and killing the family. We don't want an ambulance hitting another vehicle and injuring anybody. The data does not show any medical benefit, a minimal time savings. It's a national effort to decrease lights and sirens response. With all due respect, I don't think continuing further discussion is going to change anything, as we've had multiple meetings over several months that have yielded very minimal change. We've offered multiple public comment periods and extended those public comment periods with 0 comments submitted during those periods. So, as the EMS medical director, I do highly recommend that we implement this as recommended immediately and continue to do a rigorous QI process to ensure that we are doing the right thing for the community and continuing to adjust the EMD codes based on that continued analysis.
Thank you, Doctor.
Yeah, from what I've been presented with, what you presented, my understanding is that there is significant evidence that these changes are appropriate and that there is harm by continuing in the direction that we're currently going. As a physician, I believe in evidence-based medicine, meaning that if the evidence shows I need to change in the direction of my treatment plans, instead of going in the way I always go, I support making changes based off of evidence. And from what I'm understanding, the evidence is there. And as long as there's, opportunity to continually review and make changes as we learn, I think that it's imperative to move forward since this has been discussed for a very long time.
Thank you, sir. Thank you.
So, yeah, just from that joint statement, one thing that stood out to me was one of the bullet points, right? And it said lights and sirens should only be used for situations where the time saved by lights and sirens operations is anticipated to be clinically important to a patient's outcomes.
Yeah.
Right, so we're saying here that there's no impact to patient outcomes, but you're hearing this joint statement, there's at least alluding to some type of impact on patient outcomes, right? Yeah. So that would be my concern.
Well, as you stated,
Very
few medical calls are impacted by responding lights and sirens. And the majority of those calls, understand, are still lights and sirens in our system. They're not going to change. All of the true life-threatening calls that come in for cardiac arrest, respiratory arrest, massive hemorrhaging, all that, those all stayed lights and sirens. The changes are to the calls where the study has identified an extremely low number of critical patients, of really sick patients, based on the information entered by the paramedics and EMTs in the field. So the study is designed to look at and look for all different ranges of whether the health of the patient and make a determination based on that. So when you look at like the call I talked about in my report out, or the codes, when you talk about 37,300 versus 70, that's less than 1% of that total call volume. That's why the study said this can be downgraded, because there's a infinitesimal amount of truly sick patients. And I'm sorry, Sheriff, to your statement earlier, I believe that you're being true to your statement by voting for this, because when we implement this, it's going to make sure that those resources are available to respond to your constituents when they need them. Not as opposed to now. Think about how it's done now. A call comes in, it gets dispatched, lights and sirens, paramedic is out on it. That call ends up being a stub tow. So we have a paramedic that's on scene of a stub tow, and they're not available for the cardiac arrest that is 4 miles away. So by sending the right level of care to the right patient, you're actually speeding up the medical resources to your constituents and the fire chief's constituents.
A lot of patients that call for an ambulance don't know whether they're having a heart attack or not, don't know what their medical issue is, and they're scared. And at the end of the day, it doesn't matter if you're one of those 1.3%. It's pretty. If I'm one of those 1.3, I want you to come and hurt.
Sure.
And I think that's the part that I'm not disagreeing with you. I think this is a very tough issue, and I can see both sides. I can vote either way right now and feel comfortable.
Sure. Yeah. So apologies, I'm new to the board. I didn't time it that way. Just the election cycle. You know.
Congratulations.
You're getting trial by fire.
Yeah. Just a few observations. I don't want to get too much in the weeds, but I understand I wasn't here for the prior studies and the time commitment that's been put into this, or the meetings that you all had, sir, in fire department and you. But I guess I'm back to this number of 378 agreement, 76 still in question. He said they agreed. You said that was never conveyed to you, but just now today in public and before this board, he's committing and he's saying he's in agreement with 378. So whatever happened prior or whatever miscommunication that wasn't there, that's our starting point, in my opinion. He said he's in agreement with 378. So back to Mr. Weitzel, recommendation was, why can't we move forward on those and then go back to the 76? If he said it, is that not good enough?
I don't know what 378, what those codes are.
Okay, so
this is, like I said,
but that gets back to my other point.
Yeah.
That's why I think we would all benefit with more time to drill down on those 378, and you'll know what they are, we'll know what they are, and then we can move forward on the remaining. But I'm new. But that's my observation.
Rather than waiting 90 days, could we do a special meeting to approve those and get them going? And that's the bulk of everything.
It would be an in-person special meeting. The short answer to the question is yes, you can sit down special meeting.
And for the fire department, do you think that's something you should do?
We're more than happy to discuss, the 76. I think if Mr. Ferris's concerns is the communication between county EMS and the fire service, if we want to add more individuals to that discussion, we're open to discussing with everyone.
I think that would help. Also, in fairness to Mr. Harris, he needs to know with certainty what those 378 are and aren't.
Sure, absolutely.
Yeah, from there, so if you're willing, if they're willing, if the board's willing, I think that might be beneficial. Any more comment before we go to the public? Public comment? Anyone from the public?
Good afternoon, everyone. Dave Nelson, President of the Kern County Firefighters Association, firefighters protecting 8100 square miles. Before you today, to reiterate the things that Chief Wells says, but I also need to put a little bit of clarification on the decisions that you're making today. There's a bit of a omission in information that has been passed to you that's only related to the C3Bs of the 70 cardiac arrests. The second piece of this, the other portion of those 76 determinants that we're speaking of, we have 185 cardiac arrests associated with those downgrades. Same criteria, except it's adding fire to the response. Out of those 185 cardiac arrests, 103 of those were in the 6 Delta 2 card, which is difficulty breathing. Our precursor to pediatric cardiac arrest is respiratory distress. They have difficulty breathing and they die. I don't want to give any additional time for that family to take care of that baby or to do it to get to the call. Our concerns are how we're protecting the community and how we're delivering the service. Many more aspects of this study need to be taken into consideration. As Sheriff Youngblood said earlier, we're a huge county. We have a huge geographic footprint. Our fire stations are strategically placed to meet the needs of the community, and we are the only constant in the EMS system. You call 911, you're going to get a fire engine. That can be with a delay from the ambulance, and it's something we've experienced over the last 3 years. These folks are having a very hard time, and we understand that. I think at this point, to make a change of this magnitude with the instability that's within our system would be irresponsible of us to take out the only constant that this community has right now to be able to provide service to their loved ones. With that, I want to highlight as well that the CCMSA study, if this was the same model, then why don't we have the same outcomes with the data if it's related to the sample size? So those 37 determinants that disagree with CCMS are something that we desperately need to look at, because the ones that we do currently not have concurrence on are in line with what CCMS's current standard is, and that is keeping the responses it was. With that, I hope everybody has a good afternoon. Thank you.
Any other members of the public that would like to speak on this item? Okay. Seeing that, I'll bring it back to the board for final comments, discussion, questions before we entertain a motion. Or not.
So I would like to go ahead and just entertain a motion to approve this as and I think the evidence speaks for itself. I think the national organizations have spoken, the state has spoken with their quality measures, and I would like to move to approve this as it's proposed.
Motion?
Second.
And second. Do you want to call the vote?
I'm sorry, who seconded? Dr. Kansen, thank you.
Sorry, I couldn't see. Sorry.
Okay, Dr. Lyon, you're a yes. John Surface?
Yes.
Leslie Wilmer?
Yes.
Chris Miller?
No.
I'm sorry, that was a yes?
No.
I'm sorry, I'm having trouble hearing through the mask.
No.
I'm sorry, thank you. I want to make sure I get it right. Sheriff Youngblood?
No.
Dr. Kansen?
Yes.
Orchel Cryer? Tyler Weitzel?
No.
Chief Wells?
No.
And Chairman Flores?
No, not this time.
Okay, motion does not pass.
I make a motion, we bring it back in 90 days after the fire chief and Mr. Ferris have an opportunity to go over the numbers and make a vote at that time.
May I ask a clarification? If there's already over 300 that the fire department already agrees to, would it be possible to approve those calls that they can submit to Mr. Ferris, and we can implement those and discuss further the 70 that are not agreed upon and implement the rest of the system.
I would agree if we knew what those were.
But what could we motion that if he submits the ones to discuss, we discuss those further, and then the remainder are approved as recommended?
Was there a county council, can we do this piecemeal, or do we have to do it all?
They need to do it all at once. Whatever agreed upon, quote unquote, agreed upon was part of it. Your agenda package needs to be some reference to those. Public knows what those are. I know that it's some of those behind the scenes. Some rules approved and then come back and talk about the small subset. So I think the meeting between EMS and fire is important. They develop the document, then comes back to part of the agenda, which is these are the ones that are agreed upon, these are the ones that are not agreed. It can be presented to the public because what those are, and there's a discussion on the small set after approving the orders. That's the
Which you could do that in a special meeting if we wanted to get the 378 moving. Just get
Well,
that concurrence.
He just said we can't do that.
No, he said you could.
In the
So,
future.
so we would essentially, in a special meeting, bring back the entire list. They were agreeing on these 378. The remainders don't change while you come to a further discussion. And then within the at our next meeting, basically review the whole list again, just understanding the 76 are the ones that we really have for conversation.
So we can implement the 300 and whatever, holding back the 76.
You could have a special meeting where you present a larger number, agree for those, they would go into effect at a specific date based on your, if you voted that way at your special meeting, and then you could come back at another meeting with the remainder 76, talk about the reasons for this. That's acceptable. That would be a public special meeting. My concern was to have some other mechanism for discussion and approval that was not open. Special meeting would be open to the public. You would have your list, you would have your discussion, you would have your vote. Those would be approved. They would be implemented at your discretion to whatever date you chose. And then the remainder would be brought back after the chief, EMS, and further discussion, perhaps involving the various whatever. And then you would vote on that small system.
Or unless they make progress on both sets, then we get the whole thing. Yeah.
That's absolutely true, Mr. Chairman. Your special meeting, at the time of the special meeting, if they've had their discussion and they're good to go on the full packages, then you put that on your agenda and vote.
So we've got some motions. Sheriff Youngblood was to make the motion, so I'll defer back to him before we get a second.
I'm fine with those amendments.
So if I understood the motion correctly, it would be to come back in 30 days to hear treatment of the 378 as the fire department and Mr. Ferris get together and bring back either that set or even a larger set for consideration for.
Mr. Chairman, please get that.
Do we have a second?
Oh, I want to make sure, yes, clear. My motion is to come back and vote. If we cannot break this down one at a time, 450 different items, and you guys disagree or agree, I'm willing to vote in the next meeting, all or nothing. And I'm hoping that fire and EMS can come to some agreement on the ones they disagree on now, so that we come back, we're all on the same page. I'm going to need the list of the 378 that they conceded, so I know what I'm looking at, and then move forward to 78 from there.
I think we never had on the chair's motion. There's no greater than 90 days, which gives you
Correct.
earlier opportunity to discuss. Come back no later than 90 days to vote on this matter.
Thank you. So we have a motion, but I don't remember hearing a second. Oh, I have a second. I second.
Mr. Chairman, if I may, just as a point of clarification, are we looking to bring more people into the discussion with county EMS, or would there be other parties that county EMS would like to have as part of that discussion?
I would love to be part of that discussion, Chief.
I don't think it's appropriate to have a voting member be a part of that, well,
He's a voting member.
but it's almost a violation of the Brown Act to have 2 or 3 or 4 from this board to meet and come to a decision, and then bring back to this board for the same voting members. It's a little bit
Okay, two's okay. So
I think the meeting that I'm going to sitting board members, they in that discussion would be problematic. As I think about it, I think that representatives of Bakersfield Fire, other first responders, representatives of Kern County Fire, or whole ambulance would not be appropriate. I think sitting board members would create a Brown Act issue because they need actually a Brown Act meeting.
I'd be happy to step out and have a representative, take the fire department.
And you'll provide him with a list of.
Absolutely, by the end of today.
awesome. Good. Okay, so not seeing any further comment, we'll go ahead and call the roll.
Okay, and this is for a vote to.
The motion to push this back is at 90 days or sooner. Okay. Okay, Dr. Lyon. John Surface.
Yes.
Leslie Wilmer.
Yes.
Pardon me?
Yes.
Chris Miller.
Yes.
Thank you. Sheriff Youngblood.
Yes.
I know, I wrote it somewhere else. Dr. Canson.
Yes.
Orchel Cryer.
Yes.
Tyler Weitzel. Chief Wells is a yes. And Chairman Flores, you seconded. So yes.
So can we vote on the fly car aspect of it then?
Yeah, we're gonna.
Is that
I would like to
possible?
request a motion to vote on the ASPS update. Other than, well, actually, we're going to need it all anyway. If there's 378 that the fire department agrees upon, we're going to want to implement those as soon as possible. So I need a vote on the ambulance service performance standards as amended. I'm sorry, who seconded?
Surface and Miller.
Thank you.
Thank you, Sheriff.
You understand? I've sat. Another problem with sirens is I've sat under them for 30 years and I can't hear. Okay. Dr. Lyon.
Yes.
John Surface.
Yes.
Chris Miller.
Yes.
Thank you. And Leslie.
Yes.
Sheriff Youngblood is a
Yes.
yes. Dr. Canson.
Yes.
Orchel Cryer. Tyler Weitzel. And Chief Wells is a yes. And Chairman Flores is a yes. Okay? The motion passes.
It brings us to item 11, Manager's Report, Mr. Ferris.
Thank you, Mr. Chairman. So I made my manager's report pretty brief today, considering I assumed this would be a longer meeting. Tele 911 update. The Tele 911 use continues to increase throughout the county. Hall Ambulance Service has expanded the use to all of their rural areas. Bakersfield Fire has indicated that they should begin the onboarding process in the next month or so. Pro Safety is in the process of onboarding, and Trinity Safety will begin the process shortly. Staffing issues. Hall Ambulance has continued contracting with Best Practice Medicine out of Montana for paramedics and EMTs. Additionally, Hall has subcontracted with Pro Safety, the local provider, and numerous ambulance providers from Los Angeles and Orange counties to supplement the system. Additionally, Hall is assisting Trinity Safety in preparing to subcontract and provide 911 response in our system. EMS also has had to make some staffing adjustments. Bill Barrett resigned from his position in the EP division, which was filled by Chris Parks from operations. Chris will be taking over the second RDMHS position. We have made an offer of employment to fill the vacant position, and that individual is scheduled to start February 27th. Additionally, we have also hired a new employee for EP that will be managing the warehouse and assisting with the Kern Medical Reserve Corps. We are currently updating our destination decision policy in the process of adding Toradol, buprenorphine, and ketamine IM to our protocols. we are removing needle-crike and epinephrine for shortness of breath from our protocols as well. Certifications. The certification staff have been extremely busy. Since our last meeting, my certification staff have processed 566 EMT certs, and there are currently 228 EMT certs pending in our system. The majority of those are fire department certifications. Additionally, my team certified 7 emergency medical dispatchers, 21 mobile intensive care nurses, 31 paramedics, 12 of which were initial certifications, and that means brand new medics into our system, and 7 paramedic preceptors, so that there's people to teach the new students. We have some events coming up. Boots in the Park, March 3rd at the fairgrounds, expected to have about 6,000 people in attendance. Bequinox, March 20th through March 26th in Cal City, expected to have about 1,800 in attendance. Neotropolis, April 26th through the 30th in North Edwards, that's 1,000 to 2,000 expected to attend. And Lightning in a Bottle, May 24th through 29th at BV, and that's 20 to 30,000 expected to attend. Our quality improvement continues as a priority. As I reported out earlier, the EMD code trigger is complete, and we are currently monitoring the proposed EMD downgrades on a daily basis. As my staff reviews patient care reports, we continue to reach out to our pre-hospital care providers to both commend and provide direction when necessary. The EP division, the Emergency Preparedness Division of EMS, continues to manage the Public Health Emergency Preparedness or PHET grants, the Hospital Preparedness Program or HPP grant, and the Pandemic Influenza or PAN-Flu grants. In addition to managing the grants, the EP division is also responsible for managing the Kern County Health Care Coalition, assisting coalition partners with supplies and equipment for drills, training, and exercises, management of the Emergency Preparedness Warehouse, and preparing various deliverable emergency preparedness plans. Our EP grant staff recently attended a grant writing class in partnership with the City of Bakersfield and Bakersfield Chamber of Commerce. EP also has just acquired new heart monitors and ambulance gurneys to be used for disaster response or possible APOT teams. As I complete my report, Chairman Flores, I would like to take this opportunity to welcome you to the MCAP board and let you know that I'm always here for you if you have any questions or concerns. This concludes my report. I'm available to answer any questions.
Seeing none, we'll move along. Okay, board member announcements or reports.
I believe we need to receive and file.
Okay, so yeah, that last item.
Motion.
Second.
Okay, call the vote.
And we don't have to pull the board for this, I don't think so. Anybody opposed? Leave it to the sheriff.
Board member announcements or reports.
Mr. Chair,
Yes, sir.
tomorrow will be the 52nd anniversary of all ambulance. People keep asking me about all these weird colored ambulances around town. Those are all working for us. They're subcontracted by us. We're paying them to be here. We're paying them to run calls. And then we've got over 40 people in town right now that we brought in through traveling service. All of the rural communities now have all of their ambulances staffed, including Lamont now has a 24/7 unit. All throughout the east and west Kern, all the stations are full. So we would hope that in those areas, you'll see a marked improvement. And we're already seeing it. Like I say, I'm tracking it every day. But it's good to finally be in a position to get those stations full again, regardless of the cost. We've got to fill them and make them work.
Thank you. Congratulations on your anniversary.
Thank you.
And this is a systemic problem, not just with Kern, but statewide. We'll get through it. And thank you for your leadership and your innovation. We're going to do whatever it takes.
I was at a sheriff's meeting last week, and the only hospital left in Madera County is the Children's Hospital. The other two are closed.
And they're close to losing their ambulance company as well.
comments, we'll move to announcements. I've got two to read. Next regularly scheduled meeting is Thursday, May 11th, 2023 at 4 p.m. Same location with the caveat, if you guys come back sooner, we'll meet them and we'll notify people as required. Secondly, the deadline for submitting public requests on the next NCAB meeting agenda is April 27th, 2023 at 5 p.m. And that's to the Kern County EMS Program Manager. And so now that moves us to adjournment. I'll entertain a motion.
Second.
Motion second. Okay,
Everybody.